Hello, my name is Chelsea Taylor, and I will be doing my presentation today on tinnitus management. Okay, for my case overview, I had a 57-year-old male who had a sudden onset of tinnitus. He had very poor hygiene when he first came to see us, and he also had suicidal thoughts. My patient reported that his tinnitus was so bad that he couldn't even sleep at night. He also stated that to get any type of sleep, he had to take drugs such as Xanax and morphine. He also expressed that he hasn't been to work in weeks due to his tinnitus and that he has had thoughts about taking his own life. As far as his lifestyle goes, the patient did report that he takes care of his 84-year-old mother, which he said he has been struggling with due to his tinnitus lately. He works for a flower shop, and he also stated that he does not communicate much with others due to his tinnitus. He avoids friends, family via phone and in person as well. He prefers to be in complete silence. However, he did state that even when he's in complete silence, his tinnitus is still bothersome to him. He came into our office August of 2020 to get an audiologic evaluation, which revealed normal decreasing to moderately severe sensorineural hearing loss in his right ear, and normal decreasing to moderately severe, rising back to mild sensorineural hearing loss in his left ear. He had extremely well word recognition scores in both of his ears when presented at 70 dBHL. He had type A tympanograms bilaterally, and his otoscopy was unremarkable bilaterally as well. He denied any pain, drainage, and vertigo. On his tinnitus handicap inventory, he scored a 66. This is considered a grade 4, which is extremely severe. So, for his intervention, we did decide to give him a referral to the Spartanburg Mental Health Center. This referral was made to address his complaints of anxiety, his depression, and also his suicidal thoughts. For his tinnitus management, we did do a free hearing aid trial with the tinnitus therapy program turned on. The Sound Oasis tinnitus therapy sound machine was also given to the patient to put next to his bed to help him get some sleep at night, as well as mask that tinnitus. The patient's main goal was for the tinnitus to stop completely. He also wanted to stop thinking about the tinnitus and how much it has affected his life since it has began. He wanted to be able to attend social events such as church, birthday parties, and social outings with friends. He also wanted to be able to go to work. For his treatment plan, we decided to get Oticon Ruby 2 hearing aids. We also informed him that we would like for him to go back to work. We wanted him to slowly get back into his daily routine prior to when the tinnitus began. We provided the patient with some tinnitus management strategies, and we also reassured the patient that it is okay to bring family and friends to support you during this time. So we encouraged him to bring those family and friends to future appointments for support. We also want to let him know that he is not alone in this tinnitus journey, and we will not let tinnitus defeat him. His outcomes were amazing. After about 2 weeks, he did come back, and he stated that his tinnitus was pretty much gone and he doesn't notice it the majority of the day. This was great news. He did say that he still uses his Sound Oasis tinnitus therapy machine for sleeping and during quiet activities. He looked a lot better. He reported that the counselor definitely helped his mental state, and he was no longer having those suicidal thoughts anymore, which was great. He also stated that he started back going to church, work, and other social events with family and friends. He seemed highly motivated to continue to wear his hearing aids and to continue to use his Sound Oasis tinnitus therapy sound machine. There were no further treatment or diagnostic observations needed based on the success of his treatment plan. This case helped me realize that tinnitus can affect someone extremely bad. I have always been interested in tinnitus. However, I never knew that it could affect someone in this magnitude. During this case, I was able to figure out ways to help the patient manage his tinnitus. However, I also figured out ways to help him feel at ease and like everything would be okay. As an audiologist, it is extremely vital that we take the whole person into consideration. Although he came in for tinnitus, there were other areas of concern, such as his suicidal thoughts, his depression, and his anxiety, that needed to be addressed with the help of other professionals. This case did reinforce what I learned in our tinnitus management course, which made it applicable to a real-life scenario, which I found to be pretty cool, actually. Nevertheless, in my career as an audiologist, I will continue to observe patients with a wider scope. Yes, I will diagnose them. However, I will also examine them in totality and make the proper referrals if needed.